Over 60% of adults in the United States are either overweight or obese, and for most, that impacts their everyday life and their health. Weight loss surgeon Dr. William Graber is here this morning, and also from his office, registered dietitian Evelyn Mariani joins us. Good morning to both of you.
Morning.
Thanks for being here on Bridge Street. And Dr. Graber, let's start with you. Last year, the AMA came out and said that obesity is now a chronic medical condition. Can you explain that, what that means?
Yeah, that's correct. So we think of obesity as a condition, and it's also a disease. Mm-hmm. So it's a chronic problem that gets worse over time, and now we have treatments that can control it and even improve it.
And weight loss surgery is one of those things that can help improve people's life. But not everyone that's obese or overweight is a candidate for this type of surgery that you perform. How do you determine who is a good candidate?
Yeah, that's correct. So we have a measure called BMI where we take your body weight and we divide it by your height twice, and we come up with a number. But these numbers are just guidelines. Yeah. So we use a guideline of a BMI of 35 or a guideline of BMI of 40. But we're really looking at your diseases, such as hypertension, such as diabetes, such as sleep apnea, such as cancer. So these are all diseases that are associated with and worse with obesity. And we can improve a lot of those diseases by helping people lose weight with surgery.
Okay, now once the surgery is over, we're not done, and this is where we bring Evelyn in here. It's not like you go in for surgery and boom, that's it. Right. There's a lifestyle change after this that you have to pay close attention to, right?
There is, for sure, and we like to say a lot of times that the surgery kind of forces a lifestyle change onto people. So one of the best aspects of my job, I feel, and all of us in the office, is when we get to help patients understand that eventually they will actually be eating real food again. I think a lot of times people get nervous with surgery and they think that they're going to have some specialized diet for the rest of their life, pureed foods and powders and things like that. But the reality is, if you ate chicken, rice, and green beans for dinner before surgery, you will be eating that eventually again, even if the chicken has lemon butter sauce on it, or there's some curried vegetables with it, something spicy. So it's just you're going to eat a fraction compared to what could have fit in your normal sized stomach before surgery. You're taking smaller bites maybe than you ever had, and chewing better and eating slower. Other than that, that's really the only difference. It's once you get past the healing period. Of course, you have to do liquids and soft foods for a little while, but eventually it's real food you can enjoy with your family. You can have at a party. You cook, someone else cooks, you eat out at a restaurant. It's a normal diet eventually.
Okay, now Dr. Graber, people that are overweight many times have diabetes, and is this something that will help people with that condition?
Sure, that's a good question. Diabetes is a very bad disease that's associated with blindness, renal failure, amputations of your feet, for example. So there's been medical treatments for diabetes, and we also have a surgical treatment for diabetes, which is weight loss surgery. And when they compared medical treatments to surgical treatments, the surgical treatments do much, much better. So our diabetic patients are well treated. Most of them come off of most of their medicine, and if you follow them over time, most of them stay off of their medicine.
But is it a cure?
Yeah, good question. So the answer is, as long as they follow our directions, we consider them cured. Now, the diabetes might come back, and if we ever put their anatomy back together, their diabetes will come back. But we call it a cure.
Okay. Well, if you're interested and think that you may be a candidate for this type of weight loss surgery, Dr. Graber has two convenient offices in our area. His Syracuse office is located at 104 Union Ave, Suite 809, inside the St. Joseph Health Center Medical Office Center. The Utica office located at 125 Business Park Drive, Suite 150 in the Utica Business Park. You can also visit drgrabermd.com to learn more. And we want to also tell you that Dr. Graber is also part of our Dr. Oz Wellness Network and posted lots of great information at our website. Just click on the Sections tab at the top of localsyr.com and then Dr. Oz Wellness Network under the Marketplace. Dr. Graber, Evelyn.